Have you ever looked at a horse that seems perfectly healthy, really thriving, but you get this nagging feeling?
Yeah.
Could there be something going on inside? An invisible battle?
Or maybe you've seen those foals, the ones with the kind of telltale pot belly, or heard vets talk about a persistent cough, a worming cough that doesn't seem to respond to anything.
Exactly. Well, if any of that sounds familiar, you're definitely in the right place today. We're doing a deep dive into Parascaris equorum.
That's the equine roundworm.
And these aren't just minor annoyances. We're talking large, white, spaghetti-like worms. They can pose a really significant health threat, especially to young horses.
A devastating threat sometimes.
Right. So our mission today is to unpack the, frankly, fascinating and complex life cycle of these parasites. We want to understand how they actually impact horses, often in surprising ways.
And critically, we need to explore the challenges in treating them, particularly this huge growing problem of drug resistance.
We'll get you up to speed quickly so you understand not just what's happening, but really why this is such a concern for horse health. Well, everywhere.
All over the world, yeah.
Okay, so let's start with the basics. Understanding the enemy. What exactly is this Parascaris equorum?
Well, as you said, it's the specific roundworm we're focused on in horses. And their appearance. It's pretty distinct when they're adults. They really are large, thick, white worms. That spaghetti comparison, it's surprisingly accurate.
It paints quite a picture. And who's most at risk here? Is it every horse on the farm?
Primarily, it's the youngsters. Foals and young horses, say up to about 18 months old, they're the most susceptible.
Why them specifically?
It's mostly about immunity. Older horses generally develop a pretty strong natural immunity over time.
Ah, okay. But does that mean older horses are completely immune? Never affected?
Not completely safe, no. Adult horses can still get sick from them, especially if they're, run down for some other reason, or maybe their immune system is compromised.
Got it. So, a particular threat to the young and the vulnerable. How common is this parasite? Are we talking niche problem or?
Oh, it's incredibly common, absolutely global. You find it wherever horses are raised.
Really? What kind of numbers are we looking at?
Prevalence rates vary, obviously, but studies show anywhere from, say, 31% to 61% overall. But it gets worse.
How so?
On some farms, particularly breeding farms, the infection prevalence can hit 100%. You might find it in 80% of the foals tested.
Wow. 100%.
Yeah.
So the takeaway is if you're raising foals, this is something you will inevitably have to deal with.
You absolutely will encounter it. It's basically unavoidable.
Right. Worldwide, very common, targets the young, definitely sets the stage. Now let's get into the part I find kind of mind-blowing, their life cycle, this incredible journey they take inside the horse.
It really is an amazing biological feat in a way. And the first key thing to grasp is that it's a direct life cycle. Meaning, it doesn't need another animal, an intermediate host, to complete its cycle. It's just horse to environment to horse. Fecal-oral transmission. Simple in concept, but complex in execution.
Okay, so a horse picks up contaminated eggs from the environment. How does that whole internal process start?
It starts with the adult females living in the horse's small intestine. And they are, egg-laying machines. Truly prodigious.
How many eggs are we talking about?
Up to 170,000 eggs per day from one female worm.
Wait, 170,000 per day? That's astronomical.
It is. And all those microscopic eggs pass out in the horse's manure, contaminating the pasture, the stalls, everything.
And I understand these eggs aren't exactly fragile, are they?
Not at all. They are built like tiny tanks. They have this thick, multi-layered shell that makes them incredibly resilient.
So they can survive out there in the environment.
Oh, yes. Under the right conditions, warmth, moisture, they develop into an infective stage with the larva inside in about 10 to 14 days. But here's the kicker.
Uh-oh.
Those infective eggs can survive out there for years.
Years. Seriously. Not weeks or months, but years.
Years. Lodged in the soil, in bedding, stuck to surfaces. It means cleaning up a contaminated environment is a massive long-term challenge. You're fighting past generations of worms.
That completely changes the perspective on barn hygiene, doesn't it? Years.
Yeah.
Okay, so a young horse ingests one of these super tough infective eggs. What's the next step?
So the egg hatches in the small intestine. The larva emerges and immediately burrows through the intestinal wall, gets into the bloodstream.
Where does it head first?
First up, the liver. They migrate there via the blood. And their presence causes inflammation, sometimes scarring. They also undergo a molt in the liver, shed their skin, essentially, to grow.
Okay, so liver damage is part of the picture even early on. But they don't stay there.
Nope, the journey continues. From the liver, they get back into the bloodstream and travel to the lungs.
The lungs, why there?
In the lungs, they actually break out of the tiny blood vessels, the capillaries, and into the air sacs, the alveoli.
Wow, they physically break out.
Yeah. This whole lung migration phase takes about 14 to 17 days, and this is often what causes respiratory signs in foals.
Ah, so that's the worming cough connection. It's
Yeah.
the physical presence and movement of these larvae in the lungs.
Exactly. It causes irritation, inflammation, leads to that cough, maybe some nasal discharge.
And then, how do they get back to the gut to become adults?
It's quite ingenious, really. The irritation in the lungs makes the horse cough. They cough the larva up into the back of their throat
And swallow them again.
and swallow them again, right back down into the gastrointestinal tract.
That's incredible. So they use the horse's own reflexes to get where they need to go.
Pretty much. Once they're back in the small intestine, usually the upper parts, the duodenum and jejunum, they finally settle down, mature into adults, and start the whole cycle over by laying eggs.
And how long does that whole trip take? From ingesting an egg to having adult worms laying new eggs?
The whole process, that pre-patent period, is roughly 79 to 110 days, so about 3 months.
3 months. A complex internal migration causing damage along the way, all culminating in more eggs being shed. It's quite the biological strategy.
It's very effective, unfortunately, for the horse.
So let's talk about what this looks like from the outside. What are the signs an owner or vet might see in a horse dealing with this internal onslaught?
Right, the clinical signs, they're definitely most obvious and severe in those foals and young horses, the ones under, say, 18 months, because they lack that immunity.
And the signs depend on where the worms are in that cycle you described.
Exactly. You get different signs during the larval migration compared to when the adults are established in the intestine.
Okay, so during that early phase, the migration through the liver and lungs, what should people look out for?
That's when you might see those respiratory signs we mentioned. That persistent cough, maybe a snotty nose. Sometimes people call it summer colds.
Because it often happens in young foals during warmer months.
Precisely. It can be mistaken for allergies or just, a bit of dust irritation, but it's actually the larva moving through the lungs. Sometimes there's a low-grade fever, too.
And can that lung irritation lead to bigger problems?
It can. It can predispose them to secondary bacterial pneumonia, which is obviously much more serious. You might also just see general signs like lethargy, they seem weak, maybe don't perform as well if they're being worked lightly.
Okay. And then what happens when the worms mature and set up shop in the small intestine? What are the classic signs then?
That's when you often see the more, classic wormy foal signs. Poor growth is a big one, what vets call ill thrift. They just don't gain weight properly, or might even lose weight, even if they seem to be eating okay.
And the coat.
Their coat often looks rough, dull, just unthrifty, and then there's that pot-bellied look.
Right, the pot belly. What actually causes that? Is it just the worms themselves?
It can be partly the sheer physical mass of worms filling the intestine, especially in a heavy infection, or it can be due to the intestine being distended, kind of reacting to the worms.
And colic. That's always the big fear. How does Parascaris play into colic?
It's a major risk factor, absolutely. You can see mild or moderate colic signs just from the irritation the adult worms cause. But the really critical one is impaction colic.
Compaction, meaning a blockage.
Exactly. A small intestinal obstruction, or SIO. This is the nightmare scenario, especially after deworming a heavily infected foal.
Wait, after deworming? Why then?
Because if you use a dewormer that kills a huge number of these large worms very quickly, the dead and dying worms can literally clump together and form a physical blockage in the small intestine.
That sounds incredibly dangerous. How common is that specific type of colic?
Overall, SIO isn't super common, maybe at 0.5% of all colic cases. But here's the alarming statistic. In studies looking at SIO caused by Parascaris impaction after deworming, something like 72% of those cases happen within 24 hours of giving the dewormer.
24 hours. That's a really critical high-risk window.
It is. It tells you how carefully you have to approach deworming in a potentially heavily burdened foal.
Are there other really severe outcomes besides impaction?
Well, the impaction itself can get complicated. The intestine can twist that's volvulus or telescope into itself into susception. Diarrhea can happen sometimes too.
And the worst-case scenario?
If the intestinal wall gets damaged enough to perforate, to rupture, that leads to peritonitis, widespread infection in the abdomen. And that's almost always fatal. It's devastating.
Gosh. So given these subtle early signs but potentially catastrophic outcomes, how do vets actually diagnose this? How do you confirm it's Parascaris?
The main tool we use is the fecal egg count, the FEC. We take a fresh manure sample, process it in the lab, and look under the microscope for the eggs.
And Parascaris eggs are easy to spot.
They're quite distinct, yes. They're relatively large, roundish, with a thick, pitted-looking shell, easy to identify if they're there.
If they're there. But you mentioned that pre-patent period, the 3 months of migration. The FEC would be negative then, right? Even
Yeah.
if the foal is sick.
That is the crucial caveat. And it's where owners can get understandably confused or frustrated. During those first 2-3 months, while the larvae are migrating through the liver and lungs, they aren't laying eggs yet.
So no eggs in the manure, even if the foal is coughing its lungs out.
Exactly. The FEC will be 0. So a negative FEC in a young symptomatic foal absolutely does not rule out Parascaris.
That's such an important point for people to understand. But FECs are still useful, obviously.
Oh, definitely. They're essential later on to confirm the diagnosis once worms are mature, to figure out which horses are shedding the most eggs into the environment, the high shedders, and really importantly, to check if our deworming treatments are actually working.
Okay, so if the FEC is negative, but you have a young horse with all the signs, poor growth, rough coat, pot belly, maybe that cough, what do you do?
Often a vet will make a presumptive diagnosis based purely on those classic clinical signs in the right age group. You see that picture, you strongly suspect Parascaris.
You use imaging, like ultrasound?
Yes, especially if you suspect colic or an impaction. An abdominal ultrasound can sometimes actually show the worms. They look like bright, reflective structures inside dilated loops of small intestine.
And sometimes, I guess, the diagnosis is kind of backwards after you treat.
That happens too, yeah. It's retrospective. You deworm a foal you suspect is heavily infected, and then they pass a large number of dead worms. That confirms your suspicion.
Are there any other lab tests that might offer clues?
Sometimes during that larval migration phase, you might see an increase in a specific type of white blood cell called an eosinophil. In really severe chronic cases, you might see low white blood cell counts overall, maybe some mild anemia or low protein levels in the blood, hypoproteinemia.
Right, so multiple pieces of the puzzle to put together. Okay, we've identified the worm, traced its journey, seen the signs, figured out the diagnostic challenges. Now the big question, how do we fight back? What's the strategy for treatment and, crucially, prevention?
Well, the main goal of treatment, of deworming, is obviously to reduce the number of worms in the horse. Generally, we treat if the FEC is over about 100 eggs per gram.
And what drugs do we have available? What are the main classes?
We have a few main groups. There are the benzimidazoles, I think fenbendazole, oxybendazole. Those used to be workhorses.
Used to be.
Yeah, resistance is a growing issue, which we'll definitely get into. Then there's pyrantel, another class, and the macrocyclic lactones, that's ivermectin and moxidectin.
Ah, the MLs. I thought they were supposed to be highly effective.
They were historically considered almost 100% efficient against many parasites. But again, Parascaris has proven particularly adept at developing resistance to them too, especially the ML.
Okay, resistance is clearly looming large here. We'll circle back to that. But first, that critical point about treating heavily infected foals. You can't just hit them hard and fast.
Absolutely not. It's counterintuitive, but it's potentially lethal. Killing off a massive burden of large worms all at once is the recipe for that impaction colic we talked about.
So what's the alternative? How do you handle those cases?
Vets will usually recommend a graduated or slow kill approach. That might mean using a lower dose of the dewormer initially, or maybe using a drug that's known to be a bit less potent against Parascaris now due to resistance, ironically.
So you use a less effective drug on purpose.
Sometimes, yes, or you might split the standard dose over several days. The goal is to reduce the worm burden gradually, giving the horse's body time to clear the dying worms without causing a blockage.
That requires really careful veterinary guidance.
Essential. And very close monitoring for any signs of colic after treatment is critical. You'd also likely avoid drugs known to paralyze the worms quickly, like pyrantel or ivermectin in a suspected heavy case, because paralyzed worms might be more likely to cause an impaction than worms killed more slowly by something like a benzimidazole.
Fascinating. It's really a strategic calculation. What about routine prevention? When should foals typically start getting dewormed?
Generally, preventative treatment starts around 2 to 3 months of age. Then it might continue every, say, 6 to 8 weeks up until they're about a year old. But ideally, this schedule should be guided by regular FECs, not just done automatically.
And broodmares.
Deworming broodmares regularly, perhaps monthly in the last trimester of pregnancy, can help reduce the exposure of newborn foals.
And if things go wrong, if you do get an impaction or a twist,
Then, unfortunately, surgery is often the only option to physically remove the mass of dead worms and hopefully correct any damage like twists or intussusceptions.
Okay, so treatment involves careful drug selection and timing, but prevention. It sounds like drugs alone aren't enough, especially with those hardy eggs lasting for years. What else is needed?
You absolutely need an integrated program. Deworming drugs are just one piece. Strategic deworming based on those FEC results is key. Know who needs treating and monitor if your treatments are working.
And how do you monitor if treatments are working? You mentioned resistance.
That's where the fecal egg count reduction test, or FECRT, comes in. It's the gold standard test for resistance.
How does it work?
You do an FEC before deworming, then you give the dewormer, then you do another FEC about 10 to 14 days later. You compare the egg counts.
And what tells you there's resistance?
If the egg count hasn't dropped by at least 90%, ideally 95% or more, that's a strong indicator that the worms on that farm are resistant to that particular drug. It tells you that dewormer is failing.
Wow. So you need to test to know if your drugs are even effective anymore.
Precisely. Flying blind is how we got into this resistance mess in the first place.
Okay, besides strategic deworming and testing, what about managing the environment? Those persistent eggs.
Environmental management is absolutely fundamental, maybe the most important part, long-term. Manure management is huge.
Also.
Frequent removal of manure from stalls, paddocks, pastures, at least 3 or 4 times a week, if possible. That physically removes the eggs before they become infected or get ingested. It breaks the cycle.
Makes sense. What about pastures themselves?
Rotational grazing helps, letting pastures rest. Even better is cross-grazing with other species like cattle or sheep.
Why does that help?
Because the roundworms that affect cattle and sheep don't affect horses, and vice versa. So the other animals essentially hoover up the horse parasite eggs without getting infected themselves, helping to clean the pasture for the horses.
Clever. And avoiding overcrowding.
Definitely. High starting densities mean more manure, more contamination, higher infection pressure. Spreading horses out helps.
What about composting manure? Does that kill the eggs?
Properly managed hot composting can reach temperatures high enough to kill Parascaris eggs, yes. So that's a good way to handle manure safely.
And general hygiene. Buckets, troughs, stalls.
Basic hygiene is crucial. Regular cleaning and disinfection of stalls, feed bins, water troughs. Using raised feeders for hay and grain instead of feeding off the ground reduces the chance of ingesting eggs.
Is there anything specific that kills the eggs during disinfection?
They are tough. Some sources mention phenolic compounds, like a 5% solution, might be effective for disinfecting contaminated facilities. But physical removal of manure is usually the most practical first step.
And new horses arriving at a property.
Quarantine is really important. Don't just turn a new horse out with your existing herd, especially young stock. Keep them separate initially, do FECs, deworm them appropriately based on results before they mix with others. Prevents importing resistant worms or just adding to the farm's parasite load.
It's a lot to manage. It really emphasizes that prevention is an ongoing, multifaceted effort.
It has to be, because those eggs last for years. You can't just deworm your way out of a heavily contaminated environment. You have to tackle the environment too.
Okay, let's tackle the resistance issue head on now. You mentioned it's a growing problem. Just how bad is it with Parascaris sequorum?
It's bad. It's a significant, well-documented, and worsening problem on a global scale. It's probably one of the biggest challenges in equine parasite control right now.
And what does that mean, practically speaking?
It means that the deworming drugs we've relied on for decades are losing their effectiveness against this specific worm. Infections persist even after treatment. Horses continue to suffer the health consequences, and they keep shedding eggs, often resistant eggs, back into the environment.
Contaminating pastures with worms that are even harder to kill next time.
Exactly. It's a vicious cycle, and it severely limits our future treatment options.
Which drug classes are we seeing resistance in? Is it just one type of dewormer?
Unfortunately, no. Resistance in Parascaris has now been reported for basically all the major drug classes we use in horses.
All of them. So the benzodiazoles.
Yes, resistance to fenbendazole and oxybendazole is confirmed in many Parascaris populations. It's widespread.
Pyrantel.
Resistance documented there too.
And the macrocyclic lactones, ivermectin, and moxidectin. The ones often thought of as the big guns.
Widespread resistance there as well, especially to ivermectin. This is particularly concerning because they were our most effective options for a long time. The frequent, often exclusive use of MLs, especially in foals, seems to have really driven this resistance.
So we're running out of effective weapons against this major parasite.
In some situations, on some farms, yes. We might find that none of the available drugs work particularly well anymore. It makes treatment very difficult and underscores why prevention and non-chemical control methods are so vital.
It really forces a shift in thinking, doesn't it? Away from just routinely giving a dewormer towards a much more diagnostic, targeted approach, using FECs, using FE-seeds.
Absolutely. We have to know what we're dealing with, which horses need treatment, and which drugs, if any, actually still work on that specific farm. The era of just giving rotational dewormers every couple of months without testing, that has to end if we want to preserve the drugs we have left.
It sounds like a paradigm shift is needed in how we approach parasite control.
It is. It requires more veterinary involvement, more diagnostics, and a much greater emphasis on management practices.
Okay, so with effective treatment becoming more challenging due to resistance,
Right.
what's the overall outlook, the prognosis, for a horse infected with Parascaris?
For uncomplicated cases, if you can manage the worm burden effectively with the tools you have, the prognosis is generally good. The horse usually recovers well, although they might have experienced a setback in growth, that ill thrift we talked about.
But what about those severe cases, the ones with impaction colic, the SIO?
That's where the prognosis gets much more guarded, unfortunately. Survival rates after surgery for Parascaris impaction are significantly lower than for many other types of colic.
How much lower?
Studies vary, but one often cited figure is around 64% short-term survival, meaning making it out of the hospital. But long-term survival, looking a year out, might only be about 27%.
Only 27% long-term. That's incredibly sobering.
It is. Postoperative complications, particularly the formation of adhesions, scar tissue sticking bits of intestine together, are common and often lead to non-survival in the long run.
So preventing those severe impactions in the first place is absolutely paramount.
It's critical, which goes back to careful deworming strategies in high-risk foals and good management.
Are there any other risks or complications owners should know about besides the worms themselves?
Well, there's always a small risk of toxicosis if anthelmintics are overdosed, although that's relatively rare with modern dewormers if used correctly. It just highlights the need to dose accurately based on weight.
And for monitoring success or failure of a control program on a farm, how often should you be checking?
Regular monitoring with FECs is key. A good rule of thumb is to check at least 10% of the foals on the property every, say, 4 to 6 months.
And what's the threshold? What tells you your program isn't working?
If you find that more than 10% of those tested foals are positive for Parascaris eggs, that's generally considered a sign of failure. It means your deworming strategy, your management practices, or likely both, aren't effectively controlling the parasite, and you need to reassess your whole program with your vet.
Okay, so let's bring this all together. We've taken quite a journey ourselves today following Parascaris aquarum. We've seen it's far more than just a simple worm.
Definitely. It's a major health threat, especially to foals, with this incredibly complex life cycle designed for survival. Those eggs lasting years in the environment, that's a real challenge.
And we've really highlighted the need for a multi-pronged attack, combining diligent hygiene, smart pasture management, and crucially, a strategic evidence-based deworming plan.
Especially now, facing this widespread and frankly alarming anthelmintic resistance, the old ways just don't cut it anymore.
It really shows why that old set it and forget it approach to deworming, just giving a product every X weeks, is not only ineffective now, but it actually contributes to the resistance problem.
Exactly. Managing equine health, particularly parasite control, has to be a collaborative effort. Owners working closely with their vets, using diagnostics like FECs and FEC art, tailoring plans to their specific situation. It's about being smarter.
Knowing your enemy, knowing your farm status, knowing which tools still work for you.
Precisely.
You know, as we grapple with drug resistance, not just in horses, but across livestock, pets, and even in human medicine, this deep dive into equine roundworms really brings up a bigger question, doesn't it?
It really does.
In this world of constantly evolving biological challenges, how do we best use the tools we have, diagnostics, management, strategic treatment, to preserve the effectiveness of the precious few treatments that still work? And what does this whole situation teach us about the future of animal health, and maybe even our own?
It certainly makes you think about the interconnectedness of it all, that this isn't just about one parasite and one species. It's a lesson in adaptation, resistance, and the need for sustainable approaches to health, a constant biological chess game.
A chess game indeed. It really underscores the unseen battles and the importance of informed vigilance.